Uh, just a word about Dr. Carere. Dr. Carere is interventional cardiologist and is a former director of St. Paul Heart Center. And he is here in the capacity of Vice President Medicine for Providence Health.
Good morning, ladies and gentlemen. It might seem odd that Paul and Don asked a cardiologist to give the opening remarks, but I didn't know what to say. But being respirologists, they were always prepared to give me advice, and so their best advice was just keep it short. But what I wanted to do, I think that maybe my organ system of focus is a little different than your own, but I think many of you have very nicely demonstrated over the years that they're not so far apart at all, and there are some very distinct links, and we share a lot of common interests. And it's been my privilege over the years to work with a number of the individuals who are responsible for this symposium, and it's particularly a pleasure to be able to take part in acknowledging the outstanding work of our colleague, Dr. Jim Hogg. Jim. I do want to point out just briefly to you the importance, though, that the pulmonary medicine has had to St. Paul's and to Providence Healthcare, and it certainly traces back many, many decades. And I could steal from our colleague Dr. McManus, who likes to point out that way back in the ancient days of the 70s, this became a nidus and a focus at Providence Healthcare, again with the help of many of the individuals in this room. Providence Healthcare decided 15 or 20 years ago that they would have populations of emphasis, and it was really because of the endeavors in the research in pulmonary medicine and in ICU that patients with cardiopulmonary risks and illnesses became one, if not the pillar program at Providence Healthcare. And it continued and has continued to evolve ever since then. And I think it's poignant today that, certainly a milestone in that journey was when the James Hogg Eye Capture Center was formed at St. Paul's, and which continues as a very viable and contributing entity here. So, we've had a great collaborative relationship here, and I think another piece that becomes proud of is one moves from strictly clinical medicine into other areas is the collaborations which have been developed, and they've certainly happened here with many of these folks in this room. So we've faced many clinical and administrative and investigative challenges together, and I think the great part is it's cross disciplines, it's cross entities. We've built some strong partnerships across the city and in the province, and I think internationally, and attested to by some of the presence of you here. So it is, my formal duty is, it's an honor and a privilege really on behalf of Providence Healthcare to welcome you all as participants and as speakers to the symposium. For those of you who traveled, welcome to Vancouver and to British Columbia, and as Paul said, we hope you appreciate the weather. I thought another little difference, there's actually two other differences I noticed here. When the doors were shut, the room got very quiet. Usually we spend the first 5 minutes in the cardiology world getting people to sit down and shut up and pay attention. So I really admire that. And the other thing is that, I'm just hoping that I have my own meeting at the end of this week, which happens to be just up the road in Whistler. And I know it's probably another big difference is a lot of you came strictly for the science here. At my meeting, there's going to be disappointment because the snow hasn't been falling very much this year. But anyway, welcome. And it's my honor now to introduce Dr. Howard Feldman. I think most of you will know Dr. Feldman, who's the Executive Associate Dean of Research in the Faculty of Medicine of British Columbia. Dr. Feldman.
Thank you, Ron. Good morning, colleagues. Welcome on behalf of UBC and the Faculty of Medicine. As a neurologist, of course, it's entirely appropriate that by the time the pulmonologists and cardiologists are finished with things, what do they need? They need a neurological consultation because nothing that matters is working properly anymore. in any event, it's my sincere pleasure to welcome you. One of the joyful parts of being an Associate Dean of Research is that we get to celebrate success. We're not actually that good at celebrating success and recognizing the talent and the great contributions that we make, so an occasion like this is worth a moment's pause and reflection. And there could not be a more worthy person to recognize and celebrate than James Hogg. You've heard about the Gairdner Award. We're extremely proud of this. It's the second time in 3 years since I've been in this role that we've had this award bestowed on us. I think it begins to reflect on the university. If we think back to the beginning, the early days of Carere and Hogg, and think about how far we've come as a university, UBC now ranks as one of the top 25 research-intensive universities in the world. The Faculty of Medicine contributes 60% of the research to the university. And within the Faculty of Medicine, we have 3 preeminent foci, of which the one that's most outstanding, I would say, is heart and lung. So we have a historical moment to think about, and also for everyone in the room that makes a contribution to this enterprise, you should all feel rewarded by the symposium today. It's a testament to the preeminence of this effort. Now, one of the things that's very important is how do we measure success? And I couldn't help but notice within this program that we're going to hear from many of the trainees and those that have come and emerged in their own right from Jim Hogg's lab and environment, and that will fill the better part of tomorrow, so far as I can tell. As a neurologist, one of the things that we do understand is that the human brain is well wired to receive narratives. And it's in that spirit that I want to share a personal reflection. How many of you remember when you were a young student, maybe a second-year medical student or a second-year graduate student? Many of you do. So those are kind of heady days. Everything is new. You're trying to figure things out. So I was a second-year medical student at McGill, and Jim Hogg was the course convener of a new course within the curriculum called the Biology of Disease. And within the biology of the disease, what we came to understand were that there was a massive amount of information to learn of things that we knew, and there seemed to be an equally large space of things that we didn't know. And Jim would constantly be pushing us, even as second-year students, to try and ask the questions about the things we didn't know. And if we couldn't find the answer, those ought to be logged and looked into. So at the end of the day, the culture that we grew up with and lived with, which has stayed with me throughout my career, was if you see something and you don't understand it, don't let go of it. It's important. It should become a research question that should be answered or looked into. And I think it's that drive, that curiosity, that kind of culture that we try and build locally that's so important to our research enterprise. And while my own research ended up being successful in a different domain, I owe a debt of gratitude to Jim for the fundamental training that led us to ask the questions and not let go of them before we could legitimately look into them. And I think that above all is a signal to the tremendous influence that people can have on us and that we should each have on each other in driving the environment. So Jim, this is a tribute to you, but most of all, it's to everything you've done in this environment. Thank you.
Thank you, Howard. Now I'd like to turn the podium over to Dr. Mark Fitzgerald. Mark is the UBC head of respiratory medicine. He's going to chair the morning session then. Mark.
So thanks very much, Ron. Well, it's a real honor to be here, Jim. I feel humbled to be all of these wonderful colleagues that you've gathered from around the world and have come to show respect and honor your great attributes. And I think the words that echoed with Howard's comments was curiosity, the ability to continue to ask the question and to stimulate us all to ask the question. And as head of UBC Respiratory Division, it's humbling to think of the amount of honor and trainees that you brought here. Dr. Sin is nodding his head. We need epigenetics to produce more Don Sins and Jim Hoggs. But Ron mentioned the difference between cardiologists and respirologists. I think respirologists had some epigenetic phenomenon to make them calmer, smoother, nicer. And the cardiologists retained that hard-edged, hard-nosed, get into the left mainstem coronary artery. But it's a real honor to be here, and it's an honor, and I thank the organizing committee for giving me the opportunity to introduce such stellar international faculty. And the caliber of the faculty reflect what you've done, Jim, and I just want to make that acknowledgement at the beginning of the morning.